Welcome back, class. We're going to spend, and I'm not going to spend, I guess, a lot of time on this. Walking through the UB-04, there's certain, field locators that, form locator fields that I want to go through. So when we're talking about it, I'll highlight those that especially for you to pay attention to, because they will be the sources of where a lot of your information is going to be extracted when it comes to analyzing the information that comes off this UB-04. So we'll just start down. And again, I've got one open over here on the screen, so I'm going to kind of be scrolling back and forth. But one of the first pieces of information that, I mean, you've got like, field number 1 and 2 and 3. It's information about pay to name and the billing provider's name and information like that. And then field 3B, they talk about medical health record number. And that is somewhat important, especially if you've got a claim and you're trying to tie a medical record back to the claim. Let's say you've got a claim and you start looking at the information and the information just doesn't appear to be accurate at all. And one thing you can do, especially if you're an analyst and you may not understand, you may be a certified professional coder, but you may not have the clinical background. So you either go to the payment integrity team, you go to the medical management team at the health plan, and you say, hey, this claim doesn't look right. The information seems to be out of touch, and seem to be some really serious discrepancies, not only in the information on the claim, but what we're going to have to pay for this claim. Can you review this medical record for me? And at that point, that information that's pulling off that UB-04 medical record number is going to be the information that either you will go back to the hospital and ask for the medical record, or maybe it's the individual that's going to review it for you. We'll need that information going back and requesting that medical record. And then field number 4, so form locator field number 4 is type of bill. And type of bill is going to give you, and it's pretty straightforward. It helps you determine, is it an outpatient claim, is it an inpatient claim, maybe it's an ambi-surg claim. And it gives you an idea if when you're going to search for that claim, maybe gives you a better idea of what to expect when you pull the information off that claim. And then field number 5 is the federal tax ID number. Field number 6, it's important because it says statement covers period. And you want that beginning and end date on that in that format, and it's both from the from date and the through date, because if you need to, sometimes hospitals get a little creative, and they will try to push services through and get a payer to pay for it, even for services outside of that. Let's say it's an inpatient stay. So that statement covers period, for the most part, it's going to cover from the admission date to the discharge date. Or if you came in through the emergency room, it may cover from the time you presented at the emergency room and the time you discharge. And if that's the case, the admit date and the discharge date should still be in this range. You don't want to be paying for services outside of that kind of covered period. And then some of the other information, it's patient demographic. It's information similar to what you pull, or we talked about when we were talking about the HCFA 1500. You jump down to field number 12, and that's the admission, or the start date of care. So there's your admission date. And 13 is the admission hour, and sometimes that can be important depending on how you end up, how the contract pays for the claims. 15, it's a source of referral for admission or visit. And if you work for a health plan that requires a referral to be admitted to the hospital, that piece of information had better be filled out and be filled out accurately. And then 16 is the discharge hour. So again, depending on how the contract pays, that may be an important piece of information. 17 is the discharge status, and that's going to be important. And you want to make sure that you're actually tying that information back to some of the other fields in the UB-04, but make sure that is filled out and make sure it makes sense when you're looking at the discharge status. You've got some condition codes talking about events. You'll hear analysts or you'll hear billing people talk about, yeah, the con codes. We've got to watch those con codes. So condition codes, they're used to identify conditions or events relating to the bill that may impact the processing. So you'll hear people on both the payer side and the provider side talking about those condition codes. And then on 29, if it's a accident, again, motor vehicle, fall at Walmart, workers' comp, any of those accident type pieces of information, they want the accident state. And especially on a motor vehicle accident, that accident state is going to be important because you can, or even a workers' comp claim, depending on the state, you can. So if you're working for a national payer, you can go back and you can search the records in that particular state where the accident occurred, and you can grab some significant information, being able to access those records if you know which state the accident occurred in. Going to skip on down to field 38. It's responsible party name and address. So again, so when I worked at HealthNet, our son was still living at home, so I was covered. Even though my wife's a consultant, so as a consultant, you either have to be self-insured, you have to have a spouse or a partner or somebody that can get health insurance through their employer. So I worked at HealthNet, so I was the primary insurance person, and so I was a responsible party. The insurance policy was in my name, so it was a family policy, and it covered my son, my wife, and myself. And so if my wife or son, either one, went at the hospital, I would be considered the responsible party. And there's some other fields that we'll get to a little later that will get a little more detail on that, but I'm the responsible party. And then here's where it starts to get extremely important. So far we've had some, admit date, discharge date, some patient demographics, some information on the provider, some billing address. They're grabbing some information on who the responsible party is. But on form locator field number 42, that's where it starts from a analytical perspective. That's where it starts to become important. So form locator 42, let me make sure I've got it here, is where you're going to put the revenue codes. Could be a code for a private room, could be a code for an ICU, could be a revenue code for a labor and delivery room, could be a code for the emergency room. So you're going to start plopping in those revenue codes, or you're going to start extracting that information based on revenue codes, especially if it's a per diem contract that's driven by rates per a revenue code, so room rates especially. If it's a DRG, it's not hardly as important because you're going to be looking at the total. But at the same time, you want to make sure the revenue codes on that claim, or that revenue codes contained in the claims information, actually make some sense when it comes to looking at the DRG. And then form locator field 43 is a revenue code description. Form locator 44 is where you're going to put your HCPC codes, your CPT codes. If it's a per diem contract and if it's a revenue code that doesn't need a HCPC code or a CPT code, the hospital may actually put a rate in there. So if they've got a contracted rate for a 2-quad med surg room and it's $1,500, they may put that rate in that form locator field number 44. But a lot of those fields are going to be filled. They may be blank, or they may have some CPT codes in it or some HCPC codes in it. And you want to make sure as an analyst that the CPT codes and the HCPC codes billed actually match up with the description on those revenue codes. So that's going to be extremely important as you go through and start looking at this information. The service date on each. So if you go to form locator field 45, that's got the service dates in it. 46 has got the service units in it. 47 has the total bill charges in it. So you've got revenue code, description, CPT code, service date, service unit, total charges. That's going to be a wealth of information as you start analyzing this claim, whether it's especially if it's on a bill charge reimbursement rate from the provider, but whether it's on a per diem or on a DRG, it's going to be extremely important. And when you're talking about, you'll hear people talk about itemized bill reviews. And that's where you take a hospital claim like this, and when you receive the hospital claim, you may ask for the medical chart that goes with it so a clinician can look at it. And then you may want the itemized bill. So when you're looking at a revenue code, and it doesn't matter what the revenue code is, let's say it's a lab revenue code, there's going to be one line for that revenue code on this UB-04. Back behind this revenue code, there could be, I don't want to say hundreds of lines, but there could be several lab tests that they ran while you were in the hospital, and they're going to have a line for each one of those. And so that's the documentation, what they're doing on this UB-04 for that revenue code for the lab work. They're summing across all these individual lines on this itemized bill. And so when you do an itemized bill review, you're going to request that itemized bill because you want to see what kind of bill charges are being allocated across each of those line items that summarizes and ends up on the UB-04 for that one revenue code for that lab work, radiology, supplies, whatever revenue code it is. There could be page after page after page of charges that roll up to the information on that 04. And that's why the total charges are important. Down at form locator field 50, you've got the payer name. If you're a student, at Fisk, you're probably, you could still be covered under your parents' health care. If you are an employee at Fisk, you're probably covered under, Tennessee Blue. And so, that would, the payer name would show up Tennessee Blue that have the health plan ID. Then when you get down to 53, form locator field 53, there's where we're talking about the assignment of benefits. Remember when we talked about the HIC for 1500, if that provider doesn't accept assignment for those services, whether it's from Medicare, Medicaid, a health plan, you as the patient may be on the hook for paying the differential between what he gets from a contracted rate with one of those payers and what the bill charges are. And it can be significant. So, you always want to, if at all possible, have a provider, whether it's a hospital or individual provider, accept those assignments. Get down to form locator field 56. It's the NPI that we talked about, the national provider number, the same NPI that showed up on the HIC for 1500, the CMS 1500. And then, form locator field 57, it's the other provider ID. And a lot of times that other provider ID will be the provider ID that the health plan or the payer assigns to that provider. And then we get down to the insured's name, and that's in field 58. And so it's the example that I gave on the responsible party. I'm the insured's name. If it's my wife being admitted or my son, they're the patient. I'm the insured's name. Patient's relationship to insured. It could be my wife, it could be my son, depending on which one's in the hospital. Gonna skip down through a lot of these. If you get to 67, so now we're getting into the diagnosis code information. So if you get down to 67, that's a principal diagnosis code present at admission. And then you can have at least, multiple. This says, the instructions I'm reading from, it says up to 17. I think it may be more than that on some of the newer forms, but those will be filled in on the diagnosis code information. Again, this is the medical diagnosis code information in cells A through Q. And so that's where you're going to draw the diagnosis code information. In my experience with most, especially on the payer side, most information warehouses, even if they have the capability of holding information from that many diagnosis code fields, they're very rarely filled in because a lot of providers, especially on the hospital side, will, or especially on the physician side, they'll only put maybe 3 or 4 or 5, diagnosis codes. Hospitals may get up into double digits, but it's rare, at least in my experience in the past, it's been rare to see all of the diagnosis code fields in an information warehouse filled in. And so 67A through Q is where you've got your other diagnosis codes. And remember, when it's grouping on a DRG, hospitals can play around with all those diagnosis codes and actually call DRG creep or upcoding. It will bump that DRG payment up to a higher DRG level. You've got on the inpatient side, looks like it's field 69. It's the admitting diagnosis code. Patient's reason for visit on 70A through C. It's the reason for why the patient's there, especially if you're coming in like through outpatient registration. Like, let's say you're coming in through the ER, you come in through urgent care and they bounced you over to the ER. That's the information that's going to be populated there in 70A through C. Let's see, anything else? And then where you're going to get down to the information that's going to actually drive the DRG from a medical DRG to a surgical DRG. Remember, on the inpatient side of the hospital, ICD-10, CM is the medical information. That's the information that you're going to get up here in 67, form locator field 67. Also, the diagnosis code information, the CM diagnosis code, it's going to show up on the 1500. What you've got that's going to show up on the UB-04 is the ICD-10 PCS information. It's the surgical procedure codes. It's going to take a vaginal delivery and drive it into a cesarean section. It's going to take a medical inpatient admission and drive it up to a surgical admission. It's going to be the driving factors that's going to actually bump the payment on that DRG because it's shifting it from a medical DRG, shifting it to a surgical DRG. Doesn't always bump it up, but it's an extremely high probability that it's going to take that DRG and bump it up to a higher paying DRG. And then when you get to field 76, it's the attending provider. There's 77, it's the operating physician. 78, 79, it gives you the opportunity to put additional provider information in, and all of this provider information is going to be down in that right-hand corner, the bottom right-hand corner. So it's you have so you've got the diagnosis code starting there in 67, the medical diagnosis codes. Right below that, you've got your surgical procedure codes. And then over here in the bottom right-hand corner, you're going to have all of your physician type information listed. And that's going to pretty much wrap it up with how you would expect to glean information from that UB-04, and how you as a health informatics professional, whether you're working on the provider side or you're working on the payer side, how you can expect to glean that information off of those forms, and what you should be expected to do with that information, because that is the type of information that's going to drive, on the payer side especially, it's going to drive network management decisions when it comes to negotiating contracts. It's going to drive medical management policy issues, what services to need a referral to, which ones you need authorizations for. Do you need to contract services in an episode of care type situation? It's going to be the information that's going to drive actuary when they're setting the premium pricing that they're going out to these employer groups with. It's going to be what the CFO is constantly looking at. So as a health informatics professional, there is a significant amount of information that you can use from either the 1500 or the UB claim form to drive the financial well-being of either your company on the payer side, or if you're working on the provider side, either in a physician's office or in a hospital setting. It's going to also, the information you're providing to the senior management team of that provider group or the hospital, it's going to be significantly critical that you have accurate information, because it's going to also impact the financial well-being. And whichever group on whichever side of that financial coin has the greatest level of talent in the analytical side of the house is going to have the greatest impact on the financial well-being as they are negotiating contracts and trying to work through the distribution of that financial coin, how it's distributed between the payer side of the house and how it's distributed between both the payer and the provider side of the house. And with that, I think that's going to wind this up. And thanks for joining, and hope you find this useful.